Good morning. I'm from the Public Services International Research Unit, and we have quite a long history of looking at the impact of outsourcing on particularly public utilities but also public services. And I'm going to talk today about a report that was commissioned by Unison to look at the impact of outsourcing on NHS services, particularly in the last 5, but between the last 5 and the last 10 years. And I'm going to start by just saying a little about the sort of policy context. In a way that the NHS has quite a long history already of outsourcing services, starting in 1983. And I think it's important in terms of looking at what's actually happening now to see that sort of history and how there's been a cumulative effect of policy changes on the NHS and on other public services. So we have starting out of contracting out of catering, cleaning, facilities management, which in a way went on unimpeded by other things until certainly the year 2000. And then we also had the private finance initiative introduced in 1992. But I think particularly since 2000 in the NHS, there has been an increase in contracting out of clinical and pathology services and admin services. And that this has really sort of speeded up as the decade has gone on. But I think it's also important to be aware of 3 quite important pieces of policy that have been introduced in the last couple of years. The Open Public Services White Paper sort of sets out 5 principles of what public services should be under the coalition government. And I'd like to highlight particularly decentralisation, power decentralised to the lowest appropriate level, but also, and most particularly, diversity. Public services should be open to a wide range of providers. So the idea of opening up services is very firmly at the centre of government policy. And there are 2 other pieces of legislation. Something called the Public Services Social Value Act. And this is really trying to introduce this idea that looking at economic, social and environmental well-being as part of some of the criteria for procurement. Now, this has been introduced in the last 2 or 3 months, and I think it remains to be seen how this is actually going to be used and interpreted. But also the other piece of legislation is the Localism Act of 2011. And this really gives rights to communities to run services that were previously run by local authorities. So I think we're also going to see a move for sort of outsourcing, but run by communities. And I think this is very important in terms of some of the problems that have already been faced in the process of outsourcing. And I think also linked to this is that as part of the Localism Act, the assets which are currently maybe owned by local authorities, playing fields, community centres, can be taken over by the community if they can raise funds for them. So that's also another sort of, in a way, a form of outsourcing. But to in a way focus on this, the report that Unison actually commissioned, I think it's very important looking at outsourcing in the NHS to just think about how these terms, efficiency and effectiveness, are measured. They're actually very difficult terms to measure. And in one study in 2009, in a systematic review of healthcare efficiency measures, found that there'd actually been very few evaluations of the reliability and validity of very widely used efficiency measures in healthcare. And so the lack of research into in way how you actually measure the quality of care is really a major problem in assessing the impact of outsourcing. And there's the lack of consensus about that. But there's a question of, are these sort of outputs of healthcare, especially in relation to quality, So are there differences in output between different groups of patients, differences within a service, differences between patients? They're very difficult to measure. And I think that it essentially undermines a lot of the research that has actually been done. And very few clinical outcomes actually measure quality of life, which is actually a very important issue for patients. And also very few studies actually measure this sort of the patient's voice, what do patients actually feel. So there are some quite fundamental problems with the research that's actually done into looking at the impact of outsourcing clinical services particularly. And the study looked at quite a wide range of services, starting with cleaning, facilities management, looking at GP out-of-hours services, independent sector treatment centres, clinical services, shared services, and a little voluntary not-for-profit sector, which is still very, very small really. So cleaning, and this is sort of fairly widely known, but I think is a very important area to really identify some of the problems that emerge in outsourcing. Number of studies found that contracting out of cleaning services, it affected the way that cleaners actually work with other groups in the hospital, particularly and led to a reduction in teamwork, and that impacted on patient care. A number of studies found that in-house cleaning contractors are more likely to be integrated with infection control teams than external contractors. Many of the contract cleaning specifications, and this was whether they were in-house or for an external contractor, hadn't been updated, hadn't been reviewed regularly, and had not kept up with changes in the hospital environment. And a major problem, which in a way runs through because of the outsourcing studies, pressure to reduce costs led to problems of recruitment and retention due to low wages for both in-house and external contractors. And a lot of the evidence has actually led to the devolved governments of Scotland, Wales and Northern Ireland abandoning the contracting out of cleaning services. Facilities management, although this is something that has actually been outsourced for decades, there's actually very little relevant research on outsourcing of facilities management services. And although there's been an attempt to draw some evidence for sort of large-scale surveys done as part of NHS initiatives to grade hospitals, there was no positive evidence actually found to support the outsourcing of facilities management. And I think that the research needed to explore, different types of contracting, which requires a much more complex research process, really. GP out-of-hours servicing. This is something that's actually, in a way, been much more publicly controversial. And in a way that following through the process of the outsourcing of out-of-hours servicing shows many of the problems that are faced. First of all, there was a considerable undercosting of these out-of-hours services because they were transferred, originally GPs provided out-of-hours services, but they were transferred to external contractors. Originally GPs were contributing $6,000 a year to this new service, but actually the cost was $9,500. So some considerable undercosting there. Many of the primary care trusts who outsource these services, they were not really aware of how to commission these services, and they didn't monitor or regulate them effectively. The commercial providers who were brought in often didn't vet their staff effectively, and this has led to a sort of ongoing criticism of some of the quality of services. Again, providers of out-of-hours services, and this is also something that comes through in several studies of outsourcing, often fail to collect adequate information to measure whether people are actually accessing these services, which is very important for measuring good quality patient care. I think overall outsourcing of out-of-hours services, and many of you will be aware of the examples of Serco in Cornwall, have led to cost-cutting and a very uneven quality of service across England. Independent sector treatment centres, this, in a way, these are slightly older in some ways, but they were commissioned really as part of the NHS plan as a way of reducing waiting lists. They were set up quickly with very favourable terms for private companies, and this actually meant that often companies were being paid for operations even when there weren't enough patients to have them. Initially, independent sector treatment centres were not allowed to use NHS staff, often used overseas staff, and there was basically a separation of staff from the local NHS community, which led to a lack of coordination and of good patient care. And some studies have shown that there was actually a need for readmission following some of the ISTC operations, which was higher than expected. But I think particularly it's important to see independent sector treatment centres, not just in terms of whether they were effective in what they were trying to do, which they weren't particularly, but actually they were used really as a way of creating this NHS, a healthcare market in the NHS. And once again, the National Audit Office found that ISTC, they failed to collect enough data on patient care, which again made it very difficult to actually assess the quality of patient care that they were actually delivering. Impact of ISTCs on local health innovation, this idea that innovation is sort of somehow facilitated by the process of outsourcing, has been very limited. And the research into the effectiveness of ISTCs has often been very restricted to maybe one centre, rather than looking at all the centres in England. And also just looking at, did they reduce waiting lists? Well, no, they didn't, not particularly. So a lot of the sort of initial goals of ISTCs were not met. But I think it's very important to see they were a very important step in developing a healthcare market in England. Clinical services. This is the outsourcing of clinical services in the NHS has, in a way, been moving ahead. But the studies that have actually been done of particularly looking at the impact of competition in the NHS, a lot of the methodology is actually drawn from the manufacturing sector. And you know, if you really think, is measuring outputs and outcomes in manufacturing the same as measuring outcomes in the health sector, they are really very different. And particularly because they fail to capture the quality of care and the experience of patients. And I think it was very interesting, just particularly before the NHS Act went through, a number of studies that had been done looking at competition in the NHS were used as some sort of evidence to support the idea that competition improves the quality of care. But actually the studies were very limited, and also their interpretation was very much a sort of biased one. But a fairly recent study of how this idea that choice influences patient care and the quality of patient care actually found that choice doesn't necessarily benefit people from low incomes and from less well-educated groups, and that in that sense choice and competition have an impact on the accessibility to health care. So the evidence around clinical services is very incomplete. And so, by conclusion, I was asked the question, to what extent are negative outcomes relating to outsourcing a function of inherent structural problems or a poorly designed and delivered outsourcing? I think this is actually a very central question. If you look at the NHS, you can see much of the evidence shows that either there's a very negative aspect of introducing competition into the provision of healthcare services, or at best there are very inconclusive results. There are also some very clear failures of outsourcing, cleaning GP out of our services, and if we remember the NHS IT project, which has recently been pulled, but is also a very good example of where outsourcing failed. And so overall there's a lack of evidence to show that outsourcing actually leads to any improvements in patient care. But I think particularly we need to focus on what happens in the tendering process, because this is actually a very important sort of issue. Particularly the pressure to reduce staff cost, which is one of the sort of themes that actually runs through, why outsource. I think a second issue is how the tendering process actually affects how services are organised, how it affects the flexibility of services in responding to change, and how it affects how people in the NHS actually work together. And I think in terms of the pressure to reduce staff costs, as long as that is the driving force of outsourcing, and no matter how well designed and delivered it might be, it is a very fundamental problem and it undermines the whole process. And I think with increased competition, the result of that is that information is much less widely shared. It's often seen as commercially sensitive for private providers, but this leads to a lack of comparable data, and it also impacts on how services do or don't work together and are organised. And again, the lack of data makes it difficult to assess the impact of contracted out services as compared to in-house, and particularly on the accessibility of services for patients and on health outcomes.